my name is Paul Thomas, and I'm a family medicine doctor. That means I take care of people of all ages and stages, from young children to older adults. I did my medical school at Wayne State University School of Medicine, and I did my residency training over at Oakwood, which is now called Beaumont. Got it. I'm here today to ask some big questions about a healthcare system. A lot of people are paying way too much for their health insurance premiums. They wait too long to see their doctors, and pricing is unclear. So I'm going to offer a potential solution, and it involves some good design, and I think that's maybe why they included me. So a little bit about me. When I was 17, I started volunteering at the Cass Clinic over on Cass Avenue, and when I was in medical school, I started this group called Street Medicine Detroit, where we went out and took care of homeless folks in the community. This is a paper from the USA Today. Also in medical school, we built an outdoor clinic at the Heidelberg Project called a Beacon for the Broken Healthcare System, where we physically represented the lack of healthcare resources in the city of Detroit. There's only 50 primary care doctors in the entire city of Detroit for 680,000 people. That means there's one doctor for every 12,000 people. This map from the Citizens Research Council shows that all of these pink areas, basically all of Detroit, are underserved, medically underserved. So they don't have primary care doctors or enough primary care doctors in those areas to take care of the people who live there. And on top of that, people are hurting because these insurance premiums are going up and up. I agree that we should have insurance coverage for everyone. It's great so you don't have problems if you don't have catastrophic coverage, but there are better solutions that we can implement. This year, the rates went up by 17%. So I'm going to talk about why those rates are going up. And one of those reasons is that when your doctor bills you for $1, your doctor does not receive that dollar, okay? So the insurance companies and the hospital, they kind of fight over that dollar. So your insurance company, they have billers and coders and lawyers, and the hospital has the same thing on their end, billers and coders and lawyers. So that by the time your doctor receives that dollar, it's actually 30 cents. So I'll give you a real world example. If you have pneumonia and your doctor bills a 99214 moderate complexity code, they bill for 130 bucks. Now that $130 gets split between the insurance company and the hospital, and they kind of fight over this. So your doctor actually receives only about $40. Now, boo-hoo, your doctor's not making as much money. But that's not the point, right? The doctor is now seeing more and more and more patients instead of spending more time with you. So at the end of the day, patients, regular people are suffering because rather than getting a half hour to take care of something that's complex, you're getting 10 to 15 minutes, and that's it. And I think that's atrocious. You know, it's not the end of the world, but we can do better. Wait for the next slide to come up. So with direct primary care, we remove these middlemen. We take out the insurance company, we take out the hospital, and we deliver direct care. So when you pay $1 to your doctor now receives that dollar. And what that does is your doctor's able to spend more time with you. So in our model, we charge $49 a month, and we receive $48. There's a 2% credit card charge when we run people's credit cards, so that's why we end up with $48. But with that $48, we now have time. We have time to talk. I have time to listen and take care of you and meet you where you're at. And with that, I have time to coordinate other benefits. So like we wholesale medications, we get people at-cost labs and at-cost imaging. So one example I'll give is the EpiPen. It's $600 when you buy it through Mylan Pharmaceuticals. I'm sure you've heard of that big scandal. That medication actually costs $40, and that's what we are able to provide it to people for. So with that, we're able to provide house calls as well, because we're able to build this we're able to design a healthcare system where we actually have time to meet people where they're at when they need it, rather than forcing everybody into a one-size-fits-all system. You may not have heard of direct primary care, but it's growing across the country. Every green dot is a pure direct primary care practice. There's 500 practices in 47 states and the District of Columbia. So it's growing across the country. This will be the first one in Detroit and Wayne County. And that being said, there are a lot of people who are demanding this sort of care. So this is a map of all the individuals who have said, I want direct primary care. Every red dot is a person who said that I want this sort of care, because people want more time with their doctor, and doctors want to spend more time with their patients. It just makes sense. So this is a way that we're able to do this. Now, I've been out in the community kind of championing this throughout the city, and we were recently awarded with a grant from the mayor's office with the Motor City Match program. And so we're out talking with folks at that level. And I recently participated in a course called Retail Boot Camp with Tech Town. And I learned from a great cohort of people and learned a lot about how to run a great business in the city. And we won the pitch competition there for $7,500, so that's helped us to get going. And we're looking to grow and bring this sort of model to the city. This is me at the Open Streets Detroit, a little tie-in from a previous presentation. I was on the street level in my white coat. And what I want to do is inspire other doctors to practice in this way for so many reasons. There's a lot of social justice aspects about I can take care of anybody at any income level. Really, if you can afford $50 a month, you can afford excellent primary care services. So I'm out at the medical school encouraging people to join me. If you want to reach out to me, my name is Paul Thomas, and you can find me at plumhealthtpc.com. Thank you so much for your time. I really appreciate it.